Hi, good morning, everyone. Welcome. We are very glad that you are here. I'm Nancy Torres, a Parent Education Network Director at Family Network on Disabilities. And I'm very honored to be here sharing this space with you all. Today, our special guest is Dr. Arlene Valdez, Instructional Supervisor for the Autism Program at the Miami-Dade County Public Schools ESC Department.
Hi,
Welcome,
thank
Dr.
you
Arlene.
everyone. Thank you for having me. I'm happy to be here today to share information about our programs and a little bit about our team and how we fit into the puzzle piece of autism programs here at Miami-Dade County Public Schools.
Thank you for being here. Dr. Arlene will talk about the different available services that Miami-Dade County has for our students with autism. So, but before that, let's get started by reviewing what FND offers to parents of children with disabilities, and I'm going to share my screen. Okay. So we are a nonprofit organization created in the 80s by a group of parents with children with disabilities looking to support other parents living in similar situations. We are funded by the U.S. Department of Education and the Department of Health. We offer free services to families and professionals, and we are the statewide Parent Training Information Center and the statewide Family-to-Family Health Information Center. One of our main characteristics is that most of our board members and staff are family members of persons with disabilities or individuals with disabilities. It's important to clarify that we are not attorneys, doctors, or mental health professionals, so we don't provide legal or medical advice. What we do is to share information, resources, and support families and professionals. One of our mission statement is to achieve a complete integration of persons with disabilities in our society. And as I mentioned, we are the Parent Training and Information Center for the state of Florida. We have 3 different regions to cover the whole state, POPIN, PSN, and PEM. PEM means Parent Education Network. That is the region that covers the area where we are right now, Miami-Dade County, and this region goes from Monroe to Orlando. Besides the parent training centers, we have other programs. One is Family Star, that is for families that have children with medical complex needs. And also we have the parent-to-parent program where we have parents as volunteers to provide emotional peer support to our families. We provide like I will say 3 core activities: individual assistance to parents and professionals. Also, we have a wide array of workshops and conference. We have different, close to 50 workshops, different workshops available for our families and professionals in English, Spanish, and Creole. And also FND, in FND we organize annual conference like the Hispanic Symposium, the Academic Summit, where we cover relevant topics for our community. And we also provide technical assistance to the school district. And we work in collaboration with other organizations like Fielders, Project 10, FIN, and Early Steps. So now the floor is yours, Dr. Arlene. So if you want to share your screen.
Thank you for sharing that great information. I think it's important that our families know everything that's accessible to them, from outside of school and inside of school. And, it's a long journey and we have to be here to support one another through these journeys.
Definitely. And this is an example, this conversation is an example of, working in collaboration.
Right. So I'm going to share my screen now and I'll begin discussing. So welcome everybody. I'm from Miami-Dade County Public Schools, the Office of Exceptional Student Education, Autism Programs. I'm happy to be here today to talk about the information regarding our programs. What is our autism programs? We have 98 programs, but aside from those programs, we have a team here in the district that supports these programs. And our team is small, tiny but mighty, and we offer coaching, we offer classroom setup, some staff training on ASD strategies, autism strategies, behavioral supports and consultations, assistance with IEPs implementations, and support is provided for transitions and new program openings. We had about 10 programs opening just this year alone. Our team collaborates regularly with school personnel and ESC departments to ensure effective service delivery. We are constantly finding ways to make things better with our programs and the needs of our students and just making innovative ways for student success. What does our team structure look like? We have 10 curriculum support specialists. They are experts in autism. And then I have 2 district board certified BCBAs who provide ongoing support to schools with those private service providers, but they also help our team. So we have students with higher needs and they support our team going to the schools and as BCBAs and with their expertise. And they go help those higher need students with those behavior plans, implementing behavior plans, BIPs, safety plans, all of it. And then our CSSs, again, small but mighty, because it's 98 programs. So, the programs have the self-contained classrooms. Those automatically drive the CSS to go out to the school. So those schools have a CSS. But then in addition to that, you have the consult schools. Those are students who are in the general education, but have an IEP and have autism support on their IEP. So those are about 200 schools that are general education, but have inclusion where those students are in the general education. And our CSSs are assigned to those schools and they go to those schools and check it up on those students, making sure that those teachers are aware of the IEP, aware of the accommodations, and how to implement the IEP with fidelity. When we ask what autism support is, we don't know what it is, right? So we want to get into a little bit of what that is. And we don't provide a direct service to students, okay? What we do is provide that coaching and instructional support to teachers and staff to support the student that's in the class. We want to empower those teachers in the classroom to understand and work and learn with all of the students that have a disability. We assist with classroom setup that have, that autism aligned environmental structure. We deliver staff training with ASD strategies, communication supports, and behavioral practices. We also do behavioral consultation and problem solving, especially for those challenging behaviors. And going back to those BCBAs, this is where we integrate their expertise with problem solving for challenging cases, and we have them a part of that behavior intervention plan so that we can create a plan that works, so that we can create those replacement behaviors and offer success for our students. In addition to that, we support IEP implementation, including those accommodation goals and services. Sometimes we are asked to be part of those IEPs, especially for those more complex cases or parents who just want to some support through the process. It's sometimes a big ask because our caseload is very big, but we do make it happen. Our team, we are very involved. We follow up. We're very hands-on, and that is something that I'm very proud to be a part of here in Miami-Dade County Public Schools, and I have a great team, and I'm super proud of that. We also assist with student transitions and the opening of new ASD programs. As I said on the prior slide, we opened 10 programs this year. And every year we have those discussions about what programs are needed, where do we need them, where do we have programs that probably need some relief, and we have those discussions on a year-to-year basis. And we make those decisions with the district, and it's a process that the district has. And we also collaborate regularly with school teams and ESC departments to ensure that the service delivery is effective. And what is that is there gains. We look at the data. We look at how scores are, how the state is looking at the data. And we support the schools having data chats and just looking to see in ways that we can improve service delivery. Are we using the accommodations appropriately? We use fidelity checks. We have a support system in place to make sure that all these things are in place. And, with everything, it's not perfect. And that's where we ask for, if you receive a barrier or have a barrier, reach out to our team. As I said before, our team is very hands-on, and we will provide the support to make sure we can reduce the barrier and help support what is causing the barrier that you may face. Because it's not a one size fits all, and sometimes every need is different and every case is different. And that's what the I stand for in IEP, Individualized Educational Plan. And that is why it's important to know that we tailor every time that we speak to a family to that specific child. It's not, one size fits all. And then now I want to talk a little bit about the continuum of services and what it is here in Miami-Dade County Public Schools. Consultation in the general education class is a student who is in the gen ed. He probably has an IEP, he or she probably has an IEP, and they consult with that ESC teacher, and they follow the same gen ed curriculum that all the students, like peers, follow. There's no direct services provided to the student. They're just on consult, and the team meets regularly to see if there's anything that needs to be added or taken away from that IEP to make sure the needs of that student are being met on a yearly basis. Then there's collaboration in the general education class. That instruction is delivered in the gen ed class with support from an ESC teacher. Okay, that's that support facilitation model, push-in model. Okay, and again, it's gen ed. It's just we have that ESC teacher pushing in to provide that extra rigor for the student. You also have push-out students that receive part-time instruction in a specialized setting, and they go out just for maybe the core content, that reading. If they struggle with reading, they'll go out for that core content class with an ESC teacher. They'll come back to their general education class for the rest of their day. And that pertains to not just reading. It depends on the student and individualized to each need. So if the student would need more rigor in math, then that's when they would be pulled out, or both, right? And then you have the self-contained classroom. These are students who have their majority of their instruction in a specialized classroom setting. And they have a limited participation in the gen ed, but we in Miami-Dade County Public Schools strive to push for participation in the gen ed and inclusion. What are we doing in our self-contained classrooms to make sure that we're preparing our kids to graduate and go to the gen ed? And that's what we want for all of our students' success. And then outside of all of these continuum of services, we also have the related services, which is the therapies, which is speech and language, pathologists, occupational therapies. You have physical therapies, you have nurses for students who have medical as part of their IEP. You have art and music therapies, you have counseling, all those different services that are a part of that IEP, and they also vary by that student need. And the IEP is an individual education plan, and it's tailored to each need. It's student specific, and it has specific goals and accommodations that are tailored to each individual child. And it discusses those services and supports, whether they are instructional, behavior, or related services. And placement decisions are based on the least restrictive environment. So we always want to start at the least restrictive environment. That means that we always want to make sure that we have a discussion is that the students in gen ed, and they should be placed in gen ed first, and then we should start the interventions in the gen ed, and we move forward to the more restrictive according to the needs of those children. And then upon request, our team supports families and schools during the IEP meetings. We can explain autism-specific strategies, ensuring those goals and services align with the students' needs, and providing guidance on transitions and program options. And that is something that we stride ourselves in doing on a daily basis. We support families, and that's what matters to us, and that's our mission. And I'm sure there's more questions and more things that can be tailored to more specifics. And we can always, follow up with this conversation, and you can always reach out to our team. My office number is 305-275-9801. This is my email address. And once again, thank you for having us here today. I'm super excited to be here and share a little bit about Miami-Dade County Public Schools autism programs.
Much, Dr. Erlin. This is great information, right? And in my role as a parent, and I'm guessing many of our parents, we are not aware of the kind of support that is happening backstage in our schools, right? We don't know what kind of training and additional support the teachers and the school staff is receiving. So what will be your suggestion for a parent that is not sure, what is happening if the teacher are receiving, these services, and if the case is that they are not, what is the role of the parents to make sure that this happens?
Your school team is the first line of communication. Your school team should be the home base, and each school has a liaison for exceptional student education, and they will reach out to us, and that's how we get intertwined. Sometimes that line is blurry, and maybe a person transferred to another school site, a person left Miami-Dade County Public Schools, so it's not the same individual. And that's where we're transparent and we share our information so that you can reach out to us in the event that we had to switch out an individual, or that individual is not the connection at that school site. But we want our parents to trust and communicate with their school sites first, because their school sites are going to make sure that they reach out to us to make sure we get the trainings. We do Wednesday trainings. Our staff goes on, especially elementary schools, but at 150 dismissal on Wednesdays, we do trainings for an hour with our teams, and we go over autism strategies. We do the zones of regulation. We go over behavior strategies. We invite partners like you all, with the University of Miami, other partners, to support our teachers with behavioral strategies and supports at the school sites. And when in doubt, reach out. It's imperative that, not to feel fear in reaching out. We're here to support, we're here to help, and to reduce those barriers that families may feel when they're navigating the school process. And if they feel that their teachers need some more support, or something is missing, call a meeting and then invite, our teams, and we can all have a meeting to discuss the individual needs of the child.
And my other question would be, these continuum services that you explained, should they be explicitly written in the IEP?
They are they are under the services areas. They are.
Okay, so that's another way for parents to know if that's happening, is review the IEP carefully and check if this information that you explained is contained. These services are included in the IEP.
Right. If a child is in the general education, that will be on the IEP, and it says it in the minutes and exactly what services were agreed upon at that IEP meeting.
Excellent. Thank you so much for this great information, and I know that our parents after this will be more, maybe feel more confident about the educational services that their children are receiving. And I think that is it. And I hope that we can have you again in another presentation.
Of course, we can always follow up with additional topics. Whatever you feel your families are reaching out and asking for, we can definitely follow up and have another conversation just like this one. I look forward to it.
Great. Thank you so much, everyone. Have a great day.